Senator Stabenow. Senator Cortez Masto.
Thank you. I want to thank the chairman and ranking member of the subcommittee. It's an incredible conversation that we need to have. And I've got a number of questions, but I've only got 5 minutes, so I'm going to try to get through them. But let me caveat it by this. This is such a timely conversation because in my own family, my mother has a first cousin who can no longer live by himself. He would prefer to age in place, but he can't. And I'm assuming, and maybe I'm assuming wrong, but part of the challenge I'm hearing, and Ms. Stein, this is why I'm going to ask you to address this a little bit more, is this idea that CMS is enforcing Medicare as a short-term acute care benefit. What he needs is some sort of assisted living long-term care. So here's his option. If he can't get that from Medicare, then he's got to sell his house, take $50,000, $60,000 from whatever he sells, give it to the assisted living, and still pay $5,000 a month to be able for assisted living, and really monitor his own medication. And this is the option we're giving seniors. This is the option for individuals if they can't age in place because they can't access the benefits that we are providing for them through Medicare and or Medicaid. So can I ask, is that part of the problem we're seeing here? Should we be looking at this implementation of the law, that it is incorrectly being implemented by CMS at this point in time? That is part of the challenge we're seeing here?
Yes, it's definitely part of the challenge.
Go ahead.
Audits look to overutilization. If an agency provides care for longer than 30, 60 days, then they are afraid that they will be audited for providing more care than is the norm. And of course, the more that agencies provide care for shorter periods of time, the more the norm becomes short-term. Quality measures are based on improvement so that people who cannot improve in ambulation but may be able to maintain what they have if they have physical therapy come in, if they have aides help them at home. Their agencies will not get quality star ratings sufficiently because the quality measures are based on improvement. So we need to have quality measures that show that they've maintained or slowed decline. We need auditing that looks at underutilization, not just so-called overutilization. We need an increase on the cap of outlier payments, outlier meaning people who get longer-term care. And the PDGM, that payment model, needs to be revised so that people who are able to avoid a hospitalization are not less popular to home health agencies because they're paid less to take them from home, and that they're paid less after 30 days of care. So the payment model, the quality measures, and the auditing all needs to be revised so that it looks and tries to incentivize getting the full array of care that patients need for the length of time that they need them.
And does anyone on the panel disagree with what Ms. Stein has just said as part of the challenges that we should be focused on here in Congress? Nobody disagrees with that. Okay, I thank you, because that is exactly what I'm looking for, and I know my colleagues are as well. Let me add one thing to this, and we've talked about it's the workforce issue. And let me just couch it in this way. We have the Gwynn Center in Nevada, and it found that Nevada will need 5,300 more home health aides by 2026 to meet the growing demand for home health services. Nevada currently has around 13,000 home health workers, the backbone of our healthcare system. But in Nevada, every county is a designated healthcare workforce shortage area. And so the question is, what else do we need to be doing besides, I agree, I hear from home healthcare workers all the time, we got to increase their wages and benefits. What else should we be thinking about? What else needs to be done here to bring and really grow that workforce? It is a challenge. Mr. Dombey, I heard what you just said about the nurses and the choices that they're making, rightfully so, based on the wages that they can get somewhere else. What else should we be thinking about here? What else needs to be done?
Yeah, I mean, there are all those kinds of things that involve money, but I want to focus on something that's not. We really need to show respect to that workforce. We need to raise their image, celebrate the heroes that they are delivering the care, recognize that they're more essential to our economy, to our families, and everything else than the people who work at Dunkin' Donuts that make more money than they do. But they're not getting that kind of respect that they deserve. I mean, these are caring for grandparents and aunts and uncles and in my age group, people I went to high school with. Yes, Senator, I really am 110 years old. But, so it may sound ethereal, but it really does matter. We need to get people to want to aspire to do that work. And I know that Carrie Edwards' daughter, is one of those individuals right now as a high school student delivering those kinds of services. We need more of people like her out there to demonstrate this is a value that our country truly, truly honors.
Couldn't agree more, Mr. Tomby. Thank you. I know my time is up. Thank you.
Senator Whitehouse.
Thanks, Chairman.